And I do think that there's a place for EPO in bodybuilding. Based on anecdotal reports of bodybuilders that have used EPO, they say it's a game changer. Erythropoietin, EPO. Now, this is even more of a nuanced use compared to insulin. I've talked to cyclists who've used it. Yep. I've heard bodybuilders use it. Allegedly, one of the coaches that has now been retired was recommending EPO, again, allegedly. But I haven't really talked to bodybuilders, that really talked about dosages and protocols and that kind of stuff. Even though on paper, it does make sense to run a little bit of EPO for a blood building effect to supply oxygen and remove the metabolic waste products, carbon dioxide. Now, Kurt, I believe one of your family members was very knowledgeable about EPO.
Yeah, so my father was one of the developers of something called bloodless medicine. So it eliminates the need for blood transfusion. So he invented the machine that basically cleans your blood and gives it back to you. Okay. So it was not, so it can't be used in an emergency surgery, but it can be used for planned surgery. So instead of taking, a bag of blood from a donor that matches, you would take your own blood. They would use EPO first. So he would administer EPO first and then build your blood supply. Then they would take your own blood, spin it in this machine that looks similar to like a bone marrow machine,
right,
and administer it back. But outside of that kind of stuff, I don't have any firsthand experience with it as a performance drug. I do know endurance athletes use it.
Yeah.
You could just use you could use EQ would probably accomplish something similar.
Yeah, but of course the blood building effect of EPO would go up, or of EQ and anadrol usually brings you to 56. And then most bodybuilders kind of panic, right? They see 54, 56, like I got to donate. Whereas the cyclists, they feel perfectly comfortable having a hematocrit of 58 to 60.
What the proper way to look at it, at least how I was taught, was you look at platelet count. So platelet count is normal, regardless of the hemoglobin and the hematocrit. You don't need to be as concerned. Again, I'm not giving random medical advice to people I don't know, but if it doesn't mean just because you're slightly over the range with those numbers that you need to all of a sudden give blood. It's the platelet count that matters. If your platelet count goes up, that's a big deal. Obviously, your platelet count is low. That's indicative of other diseases, but that's really the metric. I think most doctors, again, in the United States, when they see that, it's just an immediate reaction because they're protecting their own ass. So they just want you to draw blood, but you're kind of losing the performance enhancing benefits of the steroid.
Yeah. Nowadays with the use of like enalapril, telmisartan, grapefruit extract, methylene blue, most bodybuilders keep their hematocrit in range, maybe more so than is required. Since we're using lower dosages nowadays because we're switching to the peptides, we're missing out on this blood building effect. And I do think that there's a place for EPO in bodybuilding, but how and if and the nuances, I'm not really sure. And again, based on anecdotal reports of bodybuilders that have used EPO, they say it's a game changer. Stamina-wise, like high rep leg day, and that really, allowed them for more strenuous activity and then just really putting a next level of hypertrophy response. So if that's the needle mover between having small legs and bigger legs, and you've seen that, right? In the offseason, some pro goes to work with a coach, and then the next offseason, their body part just mutated. And is that a drug thing, a training thing, an EPO thing? I guess you never really know.
Probably not a training thing.
No. Yeah, the time under tension.
Yeah. Probably a drug thing.
Yeah, probably a drug thing. So I'm going to put EPO on to be determined.
It's risky.
Dean, it's very risky, yeah. Dean, you have anything to contribute?
Like what Kurt said, when we're looking at hematocrit, we always sort of pay attention to the platelet count for clotting risk. And then obviously there's a whole other bunch of other markers we should be looking for clotting assessment. But I guess the higher hematocrit goes, the higher the potential for blood pressure to increase. And then obviously vascular resistance and shearing of the endothelium and the endothelial wall. I mean, I can see the benefits of erythropoiesis, but most guys will experience some level of erythropoiesis from anabolic steroids anyway.
Right.
And then, like you said, most people are always very cautious on looking at that number. I mean, 54, 55 isn't very uncommon. And if someone's platelet count is 180, 200, and their blood pressure is, 115/80, in the big scheme of things, what is that hematocrit saying? Just they have a lot more red blood cells. And then you go one step further and look at the hemoglobin. And then the next level down from that then is the serum iron and transferrin and ferritin level.
Yep.
And then you're sort of looking at, okay, well, is there issues here with iron dumping? Is the iron actually going into hemoglobin to give you that performance enhancing benefit? So I've had a few guys ask my opinion on it, I'm going to run EPO. I'm sort of like, well, I can't see why not, but I can't see it being a huge game changer than what you said there, that you have more oxygen carrying capability. So if you're someone who has issues with, having to use high rep sort of working sets in order to stimulate muscle fibers, and you're getting gassed very easily, where your respiratory system is what is letting you down as opposed to muscular strength. Might have some benefit there, but I like you said, I think to be determined. I've never personally utilized it.
No, I've never used it. I would like to give it a try, but this late in my career, I'm like always like, there's other stuff, safer stuff to experiment with that is a little bit more accessible. Because I've talked to several endurance guys, right? And the difference between endurance runners, obviously the time during the race is different, right? We train 1.5 hours there on the bike for 8 hours at a time. But our blood pressure, the blood pressure that increases during strenuous sets, putting all that pressure on the heart, is vastly different compared to what you would expect during a short spout of, sprinting during an endurance race. Is vastly different. So these guys can get away with blood thinners, fish oil, vitamin E, maybe baby aspirin, making sure they stay hydrated. They have a completely different metabolic pathway because they mostly work on carbs, right? Or they use some sort of lipolytic aids. So I feel that it's very risky in bodybuilding to use EPO simply because we utilize the metabolic pathways a little bit differently, and the blood pressure, like Dean alluded to. So if there's a lot of shearing, again, on the arterial walls, then how much damage are you creating, with this high blood pressure and a blood full with red blood cells? I would rather look into myo-inositol tripyrophosphate, which increases the oxygen carrying capacity of the hemoglobin. It's quite a popular nootropic, increases endurance quite a bit. So without increasing your hematocrit, you just allow your hemoglobin to carry a little bit more oxygen, and you should get a performance-enhancing benefit out of that as well, without actually increasing your risk. So that's something I'll experiment with shortly. That becomes available through one of my affiliates, ITPP. That seems to be basically a no-brainer. And if I notice a tremendous boost out of that, then I might, during a next cruise or something, experiment with some EPO. But it's very low on the priority list. Just all the guys that I talked to about it or heard talk about EPO say that it was a game changer for them. And these were all pretty big guys. So
I mean, look at what we've all done our research and reading into how it was utilized with cyclists, and they have a team who are basically at different points throughout even the night taking blood samples to see see where the RBC count is, and whether it's a go or no go for the next day's event to utilize it. So it's
all these teams got their own private doctor, man. We might be able to meet some of them at the Enhanced Games seminar.
So, and no respectful sort of amateur bodybuilders can have a medical team coming in and doing a blood draw every few hours. So
there's maybe one nurse on standby at one of the shows. That's about it. With some paramedics with oxygen. That's about it.
So
I remember, like, if you want to use EPO, you need to do a CT scan, right, to see if you have a coronary artery disease or plaque buildup. You need to do an MRI just to make sure that the blood flow through your arteries is normal, preferably both with contrast. And then you need to make sure that you check your hemoglobin and hematocrit every 2 weeks. You have one of those at-home hemoglobin meters. Stay hydrated all the time. There's so much nuance that goes into it, and how many guys are willing to do that. So let's put it in to be determined. To be determined. TBD EPO.